This conference will now be recorded.
Hi there, my name is Jamie Bannister and I work for North Yorkshire County Council Health and Adult Services, and I'm an Engagement Development Officer, which means that we're looking for new ways to be able to share information and to listen to people. And today's session is all about PPE. Something that we've all got to know a lot more about this year than we thought we would, maybe at the beginning of the year. And it's also about infection control and outbreak management. Most of the presentation today is going to be presented by my colleague Dora, who I'll introduce in a second. And we'll also be hearing from Sandra and Sam, who are people who are working at the front line and a lot of experience about some of the things that we're going to talk about today, just sharing some of their experiences. So without further ado, I'd like to introduce each of our guests. So first of all, Dora, hello.
Hello and hi everyone, I suppose. My name is Dora McCara. I'm a Health Improvement Officer working in the Public Health team in North Yorkshire County Council, and I will be doing the presentation around personal protective equipment. Yeah, I think that's me.
Thank you. Samantha?
Hi, my name's Sam Westwood and I'm a registered manager who works for North Yorkshire County Council, and I've had to recently manage an outbreak.
Thank you, Sam. Thanks for joining us. And Sandra?
And I'm Sandra Mitchell. I work for North Yorkshire County Council with Health and Adult Services, and I'm a service manager overseeing a number of services and have supported Sam with her outbreak.
Cool. So it's great to have you here. So we'll be hearing more from Sam and Sandra towards the end of the session, but we'll start with Dora, and we'll be focusing on PPE. This webinar should last approximately half an hour, and obviously it will be available for people to have a look at, and the slides will also make available as well. And there's also information about where you can ask questions after the session and get more information on our website. So I will retreat into the background and hand over to Dora. Thank you.
Thank you, Jamie. So give me one moment because I can't work the slides. There we are. So as an overview, I will briefly talk about, well, the topic of the year, really, COVID-19. And then I'm going to go through some infection prevention and control measures in social care. Then we'll focus on personal protective equipment, when to use it, what types of personal protective equipment there are, how to dispose PPE safely, what to do when you get home. I will hand over to my colleagues Sandra and Sam. So just as a start, obviously everybody will know this at this point, but in terms of COVID-19, transmission is mainly through respiratory droplets. Sorry, 2 seconds. Oops, sorry. Respiratory droplets generated by coughing and sneezing. We know that there is potential for spread through contact with contaminated surfaces. And we now have evidence, obviously, that points to aerosol transmission in indoor and poorly ventilated environments. We also know that individuals are not infectious until 48 hours prior to the onset of symptoms. We know that COVID can survive on inanimate objects up to 5 days. There are a lot of factors there around that. It depends on temperature, humidity, surface type and things like that, but typically it can survive for a few hours. So in response to all of these, the key prevention measures are good respiratory hygiene, hand washing, thorough cleaning of surfaces and frequent cleaning of surfaces, and ensuring well ventilated areas. I am aware that the majority of people know these already, so I'm just going to move on. In terms of the standard infection control precautions, these are standard sort of measures that are necessary to reduce transmission of infectious agents. So the main ones and the ones that we will go through in this presentation are hand hygiene, respiratory and cough hygiene, personal protective equipment and how to dispose of that properly. So in terms of hand hygiene, again, I'm sure everybody knows about the importance of hand washing, and it will be sort of the routine practice for the majority of people. It is essential to reduce transmission of infection, and what that means is thorough hand washing with soap and water, or the use of alcohol-based hand rub if soap and water are not available. Just to say that the preference is always soap and water. Hands should be washed with soap and water more often throughout the day and for 20 seconds. In terms of the best hand washing practice, in a care home environment, we would expect that staff and visitors, when and where they are allowed, they need to wash hands on the arrival at the workplace, when hands are soiled, before and after touching a resident or their belongings, before and after touching any equipment, before handling food, drink, or having a break in terms of vaping or smoking, before leaving the workplace, before entering or leaving a clinical area, and before and after each episode of clinical care. Again, I'm pretty sure everyone is well aware of all of these. There is a handy guide that we have included a picture of here that you can find on the government website if you haven't seen it already. In terms of respiratory and cough hygiene, in terms of reducing transmission, you know, there are many things that we can do around that. The first and most obvious one, I suppose, is that no one who is currently coughing or having, you know, a lot of sneezing or anything like that is actually in a care home. People who do have those respiratory symptoms need to be advised to get tested and obviously follow self-isolation guidance. We need to make sure that disposable and single-use tissues are available throughout sort of a setting, and that those are being used. We need to ensure that waste bins that are lined and foot operated and hand hygiene facilities are available. We need to ensure that used tissues are disposed of promptly in the nearest waste bin, and then we perform hand hygiene after coughing or sneezing. We need to encourage people, including residents, to keep hands away from eyes, mouth and nose. That is to sort of prevent any droplets entering the eye, the eyes, the mouth or the nose. Obviously, depending on people that you are working with, some people will need assistance to contain any respiratory symptoms. And for people who are immobile, they will need a container, or, you know, for example, a plastic bag nearby so that they can dispose of tissues immediately. In terms of PPE, the whole reason we're all here, the standard PPE items, and again, a lot of you will be familiar with all of this, but when providing direct care, the PPE items that we are talking about are fluid repellent surgical mask, the type QR, gloves, apron, and eye protection. All of these should be disposable, although eye protection can be reusable. PPE should be put on immediately before an episode of care and be disposed of immediately after. You might already know this, but fluid repellent surgical masks and eye protection can be used continuously while providing care until you take a break from your duties in order to drink or eat or anything like that. The order in which PPE needs to be removed is apron, gloves, mask and or eye protection if that is used. So we have included a few scenarios here. This is taken from the Working Safely in Care Homes guidance, which a lot of you will be very familiar with. But you know, we have included some scenarios here. So when you're providing personal care, which requires you to be in direct contact with a resident, so particularly around touching, or to be within 2 meters of a resident who is coughing, then you need to use disposable gloves, fluid-resistant surgical mask, apron, and you need to risk assess the need for eye protection. And what we mean by that is if a resident is coughing a lot, obviously there is a danger that respiratory droplets will enter your eyes, and in that case you will need to wear eye protection to protect your eyes. In terms of performing a task that requires you to be within 2 meters of a resident, but there will be no direct contact with them, so no touching, then you need to wear the surgical mask, a fluid-resistant mask, if there is risk of droplets. And you will see that a lot of this does come back to, is there in terms of the risk assessment of, is there a danger of respiratory droplets entering your eyes or your mouth or anything like that. And you also need to risk assess for eye protection as well, similarly to what we've said before. If you are working in communal areas with residents where there's no direct contact, but you could potentially be within 2 meters of them, you need to wear a surgical mask or a fluid-resistant surgical mask, the type 2R again, if there is a risk of respiratory droplets. And lastly, anyone working in a care home and at a distance of 2 meters or more away from residents, type 1 or type 2 surgical masks are recommended to be used. And obviously you need to adhere to the hand hygiene and respiratory hygiene protocols as we talked about earlier. In terms of the correct use of PPE, masks should be worn with eye protection if there is a risk of splashing of body fluids, as we talked about. They need to be worn at all times within care homes, unless obviously there is only one person in an office, for example. They need to be well fitting and fit for purpose, and obviously they need to cover mouth and nose. Obviously, with all these items, you need to follow manufacturers' instructions around making sure that you use them effectively and they fit properly. They need to not be touched once they're on, and they need to not be allowed to dangle around the neck, and they need to be replaced if damaged, visibly soiled, damp, uncomfortable, or difficult to breathe through them. In terms of eye or face protection, that includes full face visors, depending on what you're using. They need to be worn if blood and other body fluid contamination is likely to happen. They need to not be impeded by any accessories such as piercings or false eyelashes or anything that sort of might interfere with the eye protection or the visor. And obviously they need to not be touched once they're on. In terms of the aprons, they need to be worn to protect uniform or your clothes when contamination is anticipated or likely. They need to be worn, as we mentioned earlier, when providing direct care within 2 meters of a suspected or confirmed COVID case. And they need to be changed between patients or residents after completing a procedure or a task. Full body gowns or fluid repellent coveralls, those are for aerosol generating procedures, and we will talk about that in a minute. Those need to be worn when there is a risk of extensive splashing of blood and other bodily fluids. They need to be worn when undertaking aerosol generating procedures. They need to be worn when a disposable apron provides inadequate cover for the procedure or the task that you're performing, and they need to be changed between individuals immediately after completing said procedure or task, unless sessional use is advised. Lastly, for gloves, those need to be worn when exposure to blood and other body fluids is anticipated or likely. They need to be changed immediately after each patient and after completing the procedure or task, even on the same patient, and they should never be decontaminated with alcohol-based hand rub in between or also between use. Just a note here, double gloving is not recommended for routine clinical care of COVID-19 cases, and vinyl medical gloves should only be worn in care situations when there is no anticipated exposure to blood and or other body fluids. These are some handy sort of instructions. You may have seen those before. They are on the government website, and they are just instructions around how to put on and take off PPE. I'm not going to go through them in a lot of detail, mainly because you will already know what to do, but also to save us some time. But just note here that before you put on PPE, you need to ensure that you are well hydrated. You need to tie any hair back, remove any jewellery, and check that the PPE is the correct size for you. And then you follow this this sort of infographic, if you will. Similarly, this is the infographic as to how to remove PPE. It needs to be removed in an order that minimises the risk of self-contamination. I think that's fairly sort of straightforward. And gloves, aprons and eye protection should be taken off in the patient sort of room or cohort area. As I say, I'm not going to go through them in a lot of detail, but they are available on the government website for you to download if you haven't done so already. In terms of aerosol generating procedures, we mentioned those before. They cover a range of procedures that can increase the risk of infection. There is a list of what is classed as an aerosol generating procedure, again on the government website. Obviously, if you are doing any of them, you will know that they are aerosol generating procedures. For those procedures, the appropriate PPE is an FFP3 mask as opposed to the type 2R mask that we talked about earlier, and a long sleeve gown as opposed to the apron that we talked about earlier. The gloves and eye protection remain the same for these procedures. These items should be disposable, as with everything else. If for whatever reason there is no long sleeve gown available, you need to ensure that your arms are bare below the elbow, and you need to, when you wash hands, you need to make sure that you wash up to the elbow as well. It is uncommon for any aerosol generating procedures to happen outside of a hospital. So the majority of people in care homes and care settings won't need that level of PPE. But it is good to know what would be required if you needed to perform such procedures at any point. In terms of the disposal of PPE, and again, a lot of you will be familiar with that, personal waste of suspected cases in terms of the tissues that we talked about, any contingency pads or anything like that, any item that is soiled with bodily fluids, any used PPE, any disposable cloths or anything like that. Those items need to be stored securely in disposable rubbish bags. Those bags then need to be placed into another bag, tied securely and kept separate from other waste in a room. This waste should be put aside for at least 72 hours before being disposed of as normal. Again, I suspect that a lot of you will have those procedures in place already. In terms of getting home after work, obviously we've all are living in times of COVID for quite some time now, so you will have your own routine as to how you sort of leave work, get home, and what procedures you put in place, I suppose, to ensure that there's no potential for transmission. So I'm not going to go through this, but obviously this is also available online if you wish to have a look, and obviously you can look at it here. But generally speaking, I know that a lot of you will have your own routine around what you do after you leave work. In terms of PPE and contact tracing, if health and social care staff are providing direct care to a patient or resident with COVID and are wearing the correct PPE with no breaches, so that everything has been done properly as we outlined before, and there hasn't been any sort of time where any gloves or any masks have moved or anything like that, then you will not be considered a close contact, and there won't be a requirement to self-isolate for 14 days. The use of PPE in other settings, such as a staff room or a canteen, will not necessarily exclude an individual from being considered a close contact. So it is hugely important in those areas that you follow social distancing guidance, so that you don't meet the contact definition, the close contact definition. And just as a reminder, when we talk about close contact, what we mean is people who have been within 2 meters of a positive case for 15 minutes or longer, or within 1 meter for any length of time, really. So please bear that in mind when you are, as we said, in the staff room or the canteen or other communal areas. All staff who come into close contact with COVID cases, whether wearing PPE or not, should be vigilant to the possibility of contracting infection and should isolate immediately if they develop symptoms. So whether you have worn PPE or not, if you know that you've been in contact with a COVID case, please be very, very vigilant about any symptoms that you might develop as a result of that. That is the last slide from me, and then I will hand over to my colleagues, but this is around PPE and lateral flow testing. So you can see the requirements in this sort of graph. Obviously, care workers need to continue to follow the COVID-19 how to work safely in care homes guidance, which again, we've referenced a few times before, and I'm sure you will be familiar with. But the care home manager needs to wear the fluid-resistant surgical mask. The check-in registration operative, again, the same. The processing operative needs to wear effectively standard PPE, everything that we talked about before, and visitors, as you can see here. So, and just a last note, I suppose, from me, that PPE should be changed if it is contaminated at any point or if the staff member completes a different task. So that's it from me around the PPE refresher, if you will. I hope it's been useful, and as Jamie said earlier, there will be a slide later on that will show you how to ask questions if you've got any as a result of this presentation. So thank you very much. Jamie, I'll hand over back to you and then to Sandra and Sam.
Thank you. Before we lose you, Dora, thank you for that. And it was a whip through, and it was good to kind of have that refresher. I guess one of the things that is important is that if people were watching that and going, yeah, we know that, and as you say, we've been living with this for quite some time now. If we know that, one of the things is to reflect if you have any new colleagues or if there are people who've worked in different places and come to work where you work, just to kind of make sure that everybody knows that. And if you are watching it and going, yeah, I'm aware of that, obviously it's good to have that refresher, but it's good to kind of make sure that you're downloading those posters, making sure that some of those signs are up on the walls, the things that you said, that just keep that fresh in our minds. Because I think, and I'll bring Sam and Sandra in if we can as well. I think one of the things that we're hearing is that it's easy to forget. You know, we were on a heightened alert for much of the year, weren't we? And then we get into a space where things just go on as usual. Would you say that's fair, Sam and Sandra?
I think so. I think people do it becomes the norm, so everything relaxes. So I think it's really helpful just to keep reviewing it and keep on top of it and refreshing staff. Yeah,
because there is obviously a great risk in that, and the risk is obviously that people forget and that they move on, and that they kind of, it only takes one little thing, and outbreaks can happen. We're going to talk about the outbreaks with you in a second, obviously. But just before we do that, is there anything that Dora's raised that you were nodding along yourselves to, going, yeah, actually that is the one thing that I would raise?
I think in general, Jamie, it's just reminding staff of what the requirements are, what to do, what order to do in things, because you know, it's natural. Everybody develops their own way of doing something, and unless they stick to that routine, then there is the potential for a breach. And like I said earlier, it does become the norm. So I think it's really helpful just to remind people on a regular basis. They'll probably think you're nagging at them, but it needs to be there all the time, because if you ask staff, yes, they're fully compliant, but actually if you watch them, they're not always.
Yeah, and it's about being there for each other, isn't it? It's about kind of not being there in a nagging way, but in a kind of, look, we're all in this together kind of way.
Yeah.
So that thing about perceptions of nagging is an important thing about workplace culture, isn't it, though? I mean, we need to be able to call each other out on this, because the stakes are pretty high.
Yeah, absolutely. And you know, Sam and I will talk a little bit more about this, but it's not about blame or pointing the finger. It's supporting your colleagues and to keep safe and to keep your residents and users safe. Yeah,
absolutely. So thank you, Dora. Really appreciated that, and I'm sure people watching will as well. So I'll just come to you, Sam and Sandra, just to talk a little bit about what you've experienced this year, and what are some of the things that you think people need to be aware of to make sure that if there is an outbreak, what do you do about it? Because, you know, you've been there, you've lived through that. So I'm really looking forward to hearing some of your experience for a few minutes.
Brilliant, thanks, Jamie. Yes, Sam and I have had the pain of managing an outbreak, like I'm sure probably many of you have had, unfortunately. We thought it would probably be useful just to share some of our thoughts, our reflections, some of the things that we, looking back, we would probably do slightly differently. So I think one of the first bits was managing emotions. Sam and I were fortunate to have a week's leave together, and came back from leave to find that Sam's service was in the middle of an outbreak. So I think managing emotions first was ours. So my initial thought was, oh my goodness, if I hadn't been on leave, it wouldn't have happened. And I think Sam was probably very much the same. And then it's, you know, well, what have the staff done? How has this got in? It's just a huge roller coaster. And I think as well, managing the emotions of your staff team. So staff, again, I think initially probably thought, how has this got in? Who's brought it in? And Sam's nodding, and I think you've lost now, Sam. Yeah. So it's trying to keep everybody calm, manage those emotions, and don't beat yourself up. You know, as we'll go through a little bit later, there isn't necessarily one particular source, one particular cause. You can have the absolute best service in the world, but it can still come in. Sam, have you got anything else you'd like to add into that? I mean, obviously, as the registered manager, you came back from leave to find this.
Absolutely, and I think very much I was engulfed immediately with this sense of responsibility, and I guess, for want of a better word, guilt over what had happened, because as the registered manager, you are responsible for everybody's safety. And as I said, my initial reaction was, how's this happened? Because, you know, we'd put lots of things in place. We were following, everybody was following the guidance, and yet it still happened. And I think as we talk about some of the sort of reflective tools we've used, and the exploratory tool particularly has been very useful for me in actually following that reflective process and realizing that actually, as you say, even if you are following the guidance, things can still happen, and it can be from potentially a variety of sources.
Yeah. I think one of the things we wanted to mention was the challenges, and I'm sure everybody that's had an outbreak will have experienced this. You know, first of all, your staff. So, you know, we can't underestimate the amount of staff that this could potentially affect. And if you're a small staff team, it will have a significant impact. So I think we were lucky that we had a contingency in place already. we had over-recruited 2 bank staff. So the impact on the service itself wasn't that significant, although we did have quite a number of staff test positive and have to isolate for the duration. I think another sort of challenge is managing that morale. And I think Sam did a fabulous job of keeping in touch both with staff that were still working in service and staff that were having to isolate. I mean, Sam, do you want to just talk through what you did?
I was going to say, I made sure that first of all, for the staff who were, you know, working and carrying, you know, able to carry on, I came to the handovers and talked to people about and updated them about what was happening, so people, you know, clearly knew what the situation was and how we were managing things, and also keeping in touch with the people who weren't able to work, who had tested positive, so making regular phone calls. And that wasn't just me, that was members of my management team as well who did that. But for me, it was about making sure that everybody at every level knew what was happening and talking to them about it. And I can't overestimate, I think, the value of actually physically talking to people about situations like this.
Yeah, thanks, Sam. One of the other challenges that we found particularly was the number of phone calls that you get from people. So, you know, your phones are probably ringing constantly anyway, but we got calls from IPC, from Health Protection Team, from North Yorkshire County Council. It felt like the World Wide Wide were ringing and asking for the same or very, very similar information. And I suppose once you've had your first call, you know what they're going to be asking. So it's about making sure that your staff team who are responsible for taking those phone calls, because I know you're not going to be there all the time, so your deputies or your seniors are aware of what's going to be asked and being prepared, and almost have like a bit of a crib sheet with it all down so that you've got that information. But it does feel when you're on the receiving end as though you're being questioned constantly, and it does get very repetitive. And I think one of the other challenges that we've had is around the testing and sort of managing staff expectations as well, because of course through the outbreak we were testing staff twice a week. It was very interesting, I think, from my point of view, that about 50% of the tests that came back positive were from people who were asymptomatic. And I think that really brought it home, particularly to the staff, that actually, you know, anybody could be COVID positive, anybody could transmit this. So it just reinforced the need for the really good hygiene, the good use of PPE, and thinking about what they did outside of work as well, which sometimes is a difficult message to get across, because, you know, what staff do when they're not in work is their own business, but actually it isn't, because it does have an impact. I think through all of this, with all the challenges and everything else, one of the things that we found really useful was having an outbreak plan. Yeah. So we had a template really to work through. So when Sam and I came back from leave, that outbreak plan had already been started. So for us, it was really good to see who'd been contacted, what had been done. And as we say, there's loads of challenges. You get loads of phone calls, lots to manage. And it's just a really helpful document so that you've got all the information in there. You can record your test results. You can record who you've contacted when, what advice you've been given by the Health Protection Team, any numbers. I mean, again, Sam, it was a working document for you, wasn't it?
It was, and I think the great thing about it was because the managers who, you know, were covering for me while I was on annual leave had started it all off with support from their managers, and so it was already in place when I came back. And I think the beauty of the document is that it can be passed on. It's very, very clear when if it's already been completed, you know what information you're passing on, and it's very comprehensive. So it's something that, you know, you can pass on to somebody else if somebody else needs to take it over, but also you can update it, and it is a live document whilst, you know, you're in your outbreak.
Yeah, I mean, we reviewed it sort of every week, really, didn't we? And added and changed things. And again, it just helps you focus that little bit, and it asks things about, you know, have you got sufficient PPE? Have you got any issues? And that's the point really for you to think and go, actually, yeah, this is, I could do with some more, or it gives you the opportunity to just reflect a little bit, because I'm sure you're all just inundated with stuff on a normal day-to-day basis, and you don't get that opportunity sometimes to just step back and think. And that's where the exploratory tool came in really helpful for us as well. You know, that again, initially it felt like, oh, this is just another bit of paper to fill in, and what else am I going to have to do? But actually it gave us the time to sit back and to reflect on what we had in place. Was it working? Could we have done anything differently? And it isn't just a piece of paper. If it's used properly, it helps you focus. It isn't about pointing the finger of blame at anywhere. It is looking at, have we got everything we need? Do we need support from anywhere else? And it helps you think about where potential sources could have come from. And I think, Sam, when we looked through it, we've actually identified 7 or 8 potential different sources.
Absolutely. And going back to what you're saying about the number of staff who tested positive who were asymptomatic, if you sort of magnify that out to the outside world where people aren't being tested regularly, you know, it increases, I think, the, you know, where the sources could have come from. And again, we've used it a bit of a live document where we've been able to, you know, as we further reflected, add other things to it as well. And you know, it's helped me, I think, to think about my initial feelings of guilt and responsibility. And whilst obviously the responsibility doesn't go away, it did help me to manage those feelings and realise that actually, you know, it wasn't just, you know, as a result of something I'd maybe done or not done, you know what I mean? And I think that's, if I'm being honest, that's how I was feeling at the time. But it was a very, very useful tool to use. And as a result of that, we've introduced some processes to help us be more robust moving forward. For example, you know, a handover checklist where we remind staff of very important things that will hopefully help prevent anything happening in the future or minimise the risk.
Yeah, thanks, Sam. I think, and finally from us, because we could waffle on forever, is kind of top tips. So I think use the teams that you've got around you, use the quick team, use prevention control teams, use the management team that you've got working with you and from above. You know, you're not on your own. Don't blame yourself, although that's easy to say. You know, if you've got something like an outbreak plan, whatever that looks like, use it, because it'll help keep you on track so that you're not lurching from one thing to another. If you can use the exploratory tool, use that and share that again with your staff team. And I think one of the big things is the keeping in touch with the staff who are still working in the service and those who aren't, because we know some of them can be quite poorly with this as well. And, you know, again, it's that you're not on your own and you're not at fault. And then I think finally from me, it's be prepared. So, you know, keep your risk assessments up to date, amend them, adjust them, review them, whatever you need to do. Make sure you've got a staff contingency there. And do things like your PPE competencies just to check that everybody's up to date. And that includes, you know, as a registered manager as well, get one of your deputies to check your competency. I think that's probably about it from me, unless Sam's got anything else you would like to add.
No, as I said, I think it's just for us, we are just making sure now that, you know, the things we had in place initially, which, you know, were good practice, that we continue to maintain, and it's about reminding and refreshing.
Brilliant. Thank you. Back to you, Jamie.
Thank you, Sandra, and thank you, Sam. And look, I mean, the truth is we could listen to you all day. Unfortunately, we don't have the time. But one of the things that really came through to me there was, first of all, obviously you've been living this, and what you're describing is based really on your real experiences this year. And I know that you know, that it's not been an easy year, but here you are at the end of the year and lots to reflect on and lots to share. So thank you for doing that. And secondly, what really came strongly through was the fact that there's a lot of support out there. There's a lot of tools and resources and different people that you can talk to within North Yorkshire and within your own organisations, and thank you for sharing some of those things with us. And if people do have questions, we've got an email at the end, haven't we? And we can always put people in contact with you if you need some more help. Is that okay?
That's absolutely fine. We're happy to talk to anybody at any time, Jamie. You know, it's about sharing and learning from each other.
Absolutely, and that's why we're here. So thank you, Sam. Thank you, Sandra. I'll say thank you to Dora as well, who's still there in the background. That email that you can see on there, this is the email for a lot of general things in there. There she is. Is hascovidcoms@northyorks.gov.uk, hascovidcoms@northyorks.gov.uk, and that's for anything that you've heard today. And you can get links to some of the things that Dora also mentioned as well, and we can provide that on the government websites. Any final comments, Dora?
From me, just to say that I know that this year has been particularly difficult for a number of people, especially people working in adult social care. And just to say, overall, I think we've done well, and I appreciate that people have gone to extreme lengths to ensure people's safety. And just to say that we all appreciate that effort that goes, and we appreciate how difficult it is and what sacrifices have had to be made. So just a thank you, I suppose, and exactly just to reflect on what Sandra and Sam said, to say that, you know, we are here. If anybody has any questions, if we can help in any way, we're more than happy to do so, both from a public health team point of view and I'm sure from an adult social care point of view as well. So yeah, just a thank you for everything, and just to say, keep in touch. As Sandra said, you're not alone. There's loads of us here. So yeah, we're here for anything. That's it from me, Jamie. Thank you.
Thank you. Thank you, Sandra. Thank you, Sam. Thank you, Dora. And there'll be information on the website where this webinar is being hosted that you can follow up on some of the things that we've seen. So thank you, everybody, and we'll say goodbye for now.